If such symptoms appear, many people think, I'll go to the ophthalmologist just in case. But in fact, these symptoms are serious, and for many people, the symptoms improve within a few seconds to a few minutes. It is said that even at the longest, the symptoms will improve within an hour. I wonder if it was just my imagination. I wonder if I'm just feeling a little off, and many people end up ignoring it. This could indicate impending blood vessel collapse and stroke risk. Hello and thanks for watching. Are you aware of the signs that appear right before blood vessel collapse? In our bodies, there are capillaries that could stretch around the earth 2.5 times. Blockage in brain capillaries can cause a stroke, while heart blockage may lead to a heart attack. Obstruction in leg vessels can result in obstructive arteriosclerosis. Each of these conditions has unique signs that appear just before the vessels get blocked. Blood carries oxygen, nutrients, and enzymes throughout the body, so if the blood vessels become clogged, brain cells, heart cells, and body cells can die. Once they die, they can't be restored. Not only is there a risk of life when it comes to strokes and heart attacks, but even if you manage to survive, there's a chance you won't be able to live as healthily as before. Therefore, if you can notice it just before it gets serious, you might be able to prevent future diseases by having surgery, inserting something called a stent, or using medication to thin the blood. I would like to explain simply and easily from the perspective of a practicing doctor who diagnoses arteriosclerosis, myocardial infarction, and cerebral infarction in outpatient clinics. At the end of the video, I will also explain how to prevent arteriosclerosis, which is the root cause of these conditions, so please watch until the end. First of all, I will explain simply how our blood vessels, which are soft and flexible when we are born, gradually harden, and how arteriosclerosis progresses. If you are more interested in the symptoms just before the blood vessels clog, please skip the video. The cause of the blood vessels clogging is arteriosclerosis. And why does arteriosclerosis occur? The famous causes are high blood pressure, diabetes, and hyperlipidemia, which is a condition where cholesterol is high. And in addition to these, tobacco is also mentioned. For example, if you have high blood pressure, the pressure of the blood flowing through the vessels becomes high. Think of it like using a hose to flow liquid from a snake's mouth. If the water pressure is high, the hose becomes stiff and inflated. If the water pressure is low, the hose remains soft. Similarly, when the pressure inside the blood vessels is high, the vessels become inflated and stiff. It is thought that this high pressure causes damage to the blood vessels, and from there, arteriosclerosis begins. So, how about diabetes? Diabetes means that there is a lot of glucose or sugar in the blood. If there were a lot of sugar floating in the blood, wouldn't it damage the walls of the blood vessels? This is just an example, but by increasing the amount of glucose in the blood vessels, each endothelial cell in the blood vessels, the cells that make up the blood vessels, is said to be damaged by active oxygen. And finally, there is lipid abnormality. Lipid abnormality means that cholesterol is high. The biggest problem with lipid abnormalities is that the bad cholesterol, called low density lipoprotein cholesterol, is high. This bad cholesterol is something that carries cholesterol to all the organs in the body, but when the blood vessels are damaged, this bad cholesterol gets oxidized. Our bodies think of this as a foreign substance. It attacks the cholesterol. This is how it happens. We call the stuff that looks like gruel after cholesterol has been attacked atheroma. The gruel of atheroma is like porridge. Like porridge, a mushy substance accumulates on the walls of the blood vessels, which we call plaque. In this way, hypertension and diabetes and then cholesterol on the walls of the blood vessels. By creating plaque and thinning it, and then blood adheres to it and creates more plaque, the flow of the blood vessels is impaired and a blood clot can form there, and then the blood vessels can eventually become exhausted, causing all sorts of dangerous symptoms in the body. That's how it is. This video is especially important for the above the neck among all the blood vessels in the body. I will introduce the symptoms caused by the narrowing of the neck vessels or blood clots flying from there. Everyone, do you know that when arteriosclerosis progresses, the blood vessels in the neck become thin? Actually, there are not only one main blood vessel that sends blood flow to the brain on the left and right. In short, if these blood vessels become painful and narrow, or if a blood clot flies out, you may develop a cerebral infarction. I will talk about this later, but unexpected symptoms may also appear. However, even though 10% of the elderly have narrowed arteries in the neck, they have no symptoms at all. And it is said that if these neck blood vessels are 75% narrowed, 5% of people will develop a stroke each year. Even if there are no symptoms, the risk of stroke is lurking. I think it's very scary. If it can be detected early, even if there are no symptoms, you can drink medicine to make your blood smooth, and depending on the need, you can receive surgery surgery or catheter treatment that I will talk about in the second half of the video. You can prevent the risk of future strokes. With that said, this time, let's learn about the signs that the blood vessels in your neck are about to become painful so that you can detect it early. And can you get rid of the plaque that has formed in your neck, or can you stabilize it? I will talk about how to prevent your neck blood vessels from becoming narrow in the second half of the video. I will also introduce easy to adopt dietary methods, so please watch until the end. In this way, at YouTube Medical University, we are broadcasting videos that can make you healthy from tomorrow, with responsibility from the doctor's standpoint. I would be really happy if you could subscribe to the channel so that you don't miss new videos. Here is the table of contents for today. In the first part, I will introduce the signs that the blood vessels in your neck are about to become clogged. In the second part, I will introduce 7 ways to prevent the narrowing of the neck blood vessels, which is the root cause. The first sign that the blood vessels in your neck are about to become clogged is this. It's when your vision becomes blurry. You might not associate neck blood vessels with eye symptoms. Have you ever heard the term glaucoma? Glaucoma may be unfamiliar to some, but it's quite straightforward. The ophthalmic artery, which branches off from blood vessels carrying blood from the neck to the brain, supplies nourishment to the eyes. When this artery becomes constricted, a condition called glaucoma occurs. So, what kind of symptoms occur? Suddenly, one eye becomes hard to see, your field of vision becomes completely dark, or there is pain in the back of the eye. When these symptoms occur, we suspect glaucoma. If such symptoms occur, many of you might think, I should go to the ophthalmologist right away. The reason why these symptoms are serious is that many people improve in a few seconds to a few minutes. It is said that even at the longest, it improves within an hour. Was it just my imagination? Am I feeling a bit off? Many people tend to ignore these symptoms. However, this could be a sign that the blood vessels are about to constrict. There is a possibility of a stroke. Even if these symptoms appear and improve immediately, it's not necessarily a good thing. Even if symptoms improve quickly, data shows 10-15% of people will have blood vessels constrict again within 3 months. Half of those will have it happen again within half a day. In summary, if you suddenly have vision difficulty, darkening vision, or eye pain in one eye, this could be a sign of glaucoma. So, it's necessary to immediately see a specialist such as an ophthalmologist or a neurosurgeon. So, why do symptoms suddenly appear and then improve after a while? The main reason for this is often found in the neck. When you have carotid artery stenosis, plaques, fat clots, form on the walls of the blood vessels. If these fat clots get damaged, blood accumulates and forms a thrombus, blood clot. These can peel off and block the blood vessels in the eye. However, if the blood clot is small, our body can dissolve it. Therefore, even if you have difficulty seeing or experience pain, it can improve after a while. But it's not always like that. Behind this, neck vessel plaques become unstable and blood clots form in most cases. Without improving these causes, the risk of vessel reclogging or cerebral infarction increases. Understanding the reason makes it easier to remember and judge correctly. Despite internet misinformation, remembering the reason prevents confusion from incorrect information. YouTube Medical University plans to explain carefully, including such reasons, so please subscribe if you like. The second sign that the neck vessels are about to clog is a transient ischemic attack. It may sound difficult with 3 alphabetic letters, but please think of it as a sign just before a cerebral infarction. It's called a transient cerebral ischemic attack. Earlier, it was about eye symptoms, but this time it occurs when the plaque in the neck flies to the brain. As a result, symptoms similar to cerebral infarction appear, but in fact, these symptoms improve within an hour for 40% of people. For example, even if symptoms such as I can't move my right hand appear, many people will ignore it if it heals quickly. I had a little trouble talking, but maybe it's because I'm sleep deprived, or I was just tired, you might think. However, if you overlook such initial symptoms, you will not be able to prevent a serious cerebral infarction that will come later. The symptoms of a transient ischemic attack or a temporary cerebral ischemic attack, simply put, are when symptoms of a cerebral infarction appear temporarily and then disappear. With that said, I will introduce the initial symptoms of cerebral infarction. If the symptom is that one side of the hand is hard to move, it's easy to understand, but there are unexpected symptoms that can be a sign of cerebral infarction, so please listen. The brain is the command tower of our body. If the brain is damaged, symptoms such as difficulty breathing or difficulty moving the body will appear. This is to save lives and to prevent any after effects. There is a golden time for cerebral infarction. If symptoms appear and are within 4.5 hours, the use of medication to dissolve the blood clot in the brain can increase the survival rate significantly and reduce the after effects. There is data that the possibility of paralysis remaining in the body decreases, so it is important to see a doctor at a hospital as soon as symptoms appear. If you have any of the 5 symptoms I will mention next, please consider seeing a doctor at a hospital. The first symptom of a cerebral embolism is the inability to exert force in your limbs. The brain controls the movement of the body, so if the cells in that part die, you will not be able to exert force in your limbs. Specific symptoms include not being able to hold food properly when eating or stumbling and falling even while walking. And the characteristic is that only one side of the body cannot exert force, which is a more typical symptom of a cerebral embolism, so please be careful. The second symptom is abnormal sensation. All sensations such as warmth, cold and pain are perceived in the brain through nerves. When a cerebral embolism occurs, you may not feel heat or cold, which can lead to burns, abnormal sensations, numbness or pain in the body. Especially when these symptoms appear on the shoulder side, you need to be careful. The third symptom is the inability to turn your tongue. This is also called dysarthria, but even if you haven't been drinking alcohol, you can't turn your tongue, your words are hard to hear, and you can't speak clearly. If you or someone around you has such symptoms, there may be a possibility of a cerebral embolism, especially if sounds like ata are hard to produce. Even if you say pata pata over and over again, if you can't speak well, it may be a symptom of a cerebral embolism. The fourth symptom is abnormality in the eyes. When the nerves that move the eyes are damaged, the focus of objects does not match, and things may appear double, and the images seen from the eyes are projected to the back of the occipital lobe of the brain. But if this is damaged, half of the field of vision may become invisible. Such symptoms occur. Often you may not be aware of it yourself, so you may not notice the person on your right, or the people around you may deliberately do this and look to the right in the middle to see what is on the right. If you have such symptoms, there is a possibility that you cannot see half of your field of vision. The fifth symptom is dizziness. In our brains, there is actually a small cerebellum at the bottom, a tiny brain and a written organ. This cerebellum is actually the organ where the nerve cells of the brain are most densely packed. What is this cerebellum doing? It is complex body movements. Whether it's winning a victory there, moving, or moving your body smoothly to walk straight, it's adjusting such delicate movements. If that part is impaired, you can't stand straight, you get dizzy, you feel sick and vomit, and you stagger as if you're drunk. If such symptoms appear, there is a risk of cerebral infarction. This is a review so far. When the blood vessels in the brain are damaged, you may lose strength in your body, not notice warmth or coldness, not be able to turn your eyes, have eye abnormalities, and have dizziness. And these are not symptoms of the blood vessels being strained. The same symptoms appear just before the blood vessels are strained. For just 5 minutes, you may lose strength in your body, or have dizziness or eye abnormalities for just 5 minutes, but after 30 minutes, those symptoms completely disappear. Such symptoms are actually a sign just before the blood vessels are strained. How about that? As a sign just before the blood vessels in the neck are strained? It is an early symptom of glaucoma and cerebral embolism. I introduced transient ischemic attack, a transient cerebral rejection episode. So, how can we detect early arteriosclerosis of the neck, which causes these symptoms, and stenosis of the carotid artery? What kind of examination is effective? That's exactly what a carotid artery echo is. An echo is an ultrasound. We use a small device like this and apply it to the neck. By doing so, we can determine whether the blood vessels in the neck are narrowing using ultrasound. Generally, if the blood vessels in the neck are 50 to 75% narrowed, we recommend consulting with a neurosurgeon or similar for appropriate treatment. Depending on the case, we may use medications to lower cholesterol or thin the blood. There is also the option of choosing a treatment method to prevent future cerebral infarctions. In actual cases where the neck blood vessels appear to be narrowing on an echo, we use magnetic resonance imaging to further investigate whether there are any parts of the neck or brain blood vessels that are narrowing. This is quite a high risk. In the future, it could lead to a stroke. For such people, we actually perform surgery too. We may remove the plaque from the neck vessels or use a device called a catheter to place a stent, a mesh-like object, in the neck vessels to widen the narrowed vessels. The actual procedure of opening the neck vessels and removing the plaque is called carotid endarterectomy. The treatment of widening the neck vessels with a stent is called carotid artery stenting, especially for those who have shown the symptoms we talked about earlier. Are your neck vessels narrowing? It would be good for those who are worried to consult with their local doctor or a neurosurgeon and have an examination. Please consider consulting. Ideally, you wouldn't experience such symptoms before noticing the signs we've just discussed, right? In the structure of a hospital, early detection and treatment can lead to medical benefits, but the knowledge to prevent diseases in that structure is often not known to the general public. This time, as a way to prevent arteriosclerosis in the neck, especially since cholesterol is often the cause, I will introduce 7 dietary methods to lower cholesterol. The first of these 7 dietary methods to lower cholesterol is phytosterol. I think many people have never heard of phytosterol. It is also called plant sterol. Phytosterol is simple. It is contained in plants, fruits, and grains. It's a plant-based oil. It is found in sesame seeds, flax, peanuts, soybeans, vegetable oils, sesame oil, nuts, avocados, chocolate, and so on. What's great about this phytosterol is that it inhibits the absorption of the oil we take in through our mouths. Even if you take in oil, the amount that comes out as it is increases, so there is a lot of data that says that cholesterol levels relatively do not rise. For example, even if you take medicine to lower cholesterol, there is data that the total cholesterol and low-density lipoprotein cholesterol decreased in the group that added 0.18 ounces of phytosterol per day compared to the group that did not add anything, for patients whose low-density lipoprotein cholesterol exceeds 130. In addition, in a German study among 85 patients with type 2 diabetes, they were given food containing 8% phytosterol and consumed 0.7 ounces. After 12 weeks, the results showed that those who had taken this phytosterol had a mitigation in the rise of bad cholesterol. In addition, in a study in Iran, this sesame oil contains phytosterol. If you take 2 tablespoons of this sesame oil a day for 12 weeks, there is data that the total cholesterol value has decreased. Sesame oil is also easy for Japanese people to get used to. You can expect to lower cholesterol just by changing the salad oil you usually use to sesame oil, whether it's for salad or stir-fry. The second of the 7 dietary methods to lower cholesterol is water-soluble dietary fiber. Everyone, do you know that there are water-soluble and insoluble types of dietary fiber? As the name suggests, water-soluble dietary fiber is water-soluble dietary fiber is, as the name suggests, dietary fiber that dissolves in water, and insoluble dietary fiber does not dissolve in water. Both are good for improving bowel movements, but insoluble dietary fiber does not dissolve, so it increases the amount of stool and improves bowel movements. On the other hand, water-soluble dietary fiber softens the stool by dissolving in water and also serves as food for intestinal bacteria, helping to regulate your stomach. Such effects are expected. A meta-analysis of high-credibility papers found that consuming more water-soluble dietary fiber reduces total cholesterol and low-density lipoprotein cholesterol levels. Impressive, right? Studies show that for every gram of dietary fiber consumed, bad cholesterol levels drop by 2.2 on average. That's incredible. Make an effort to consume water-soluble dietary fiber, which can be tricky to get enough of if you're not mindful. Foods rich in water-soluble fiber tend to have a sticky texture. If you think of it as something slimy, it's easier to understand. Natto, okra, mozuku, mekabu, nagaimo, and squid, for example. I've chosen things that are slimy and sticky, but these are the kinds of foods that contain a lot of water-soluble dietary fiber. Especially recommended is natto. Natto is not only rich in protein, but also it contains both water-soluble and insoluble dietary fiber. It's also rich in vitamins and minerals, and it contains a substance called nattokinase, which is said to help keep the blood smooth. Another recommended source of water-soluble dietary fiber is wakame. Wakame is rich in minerals and low in calories. If you buy dried wakame, it's easy to store and you can eat a lot of it cheaply. And wakame is because it's mostly dietary fiber, eating this wakame can help moderate the rise in blood sugar levels after meals. There's also data suggesting that wakame itself can help suppress the rise in bad cholesterol. It's said that the effects are not diminished even with dried wakame compared to fresh wakame. So, Why not try incorporating wakame into your diet by adding it to pickled dishes or miso soup? It could help lower your cholesterol. The third item on our list of dietary methods is amani oil. I'm sure many of you have heard of amani oil, but I suspect most of you haven't actually eaten it. In fact, I myself have hardly ever eaten it. This amani oil contains omega-3 fatty acids, including alpha-linolenic acid, which is known to lower bad cholesterol. It's currently receiving a lot of attention. In a Japanese study, participants were split into two groups, one of which consumed alpha-linolenic acid, consumed 10 grams of amani oil, while the other group consumed 10 grams of corn oil, which contains almost no alpha-linolenic acid. They were asked to consume this once a day during dinner, and then a study was conducted to observe how their cholesterol levels changed over a period of 1 to 3 months. This is the graph of the study results. The black dots represent the decrease in cholesterol levels in those who consumed amani oil. The white dots represent corn oil. 4 weeks or 1 month into the study, those who consumed amani oil saw a 25.8%. It is said that their low-density lipoprotein cholesterol decreased. In other words, their cholesterol levels dropped by about a quarter. Isn't that amazing? Just by consuming 0.35 ounces once a day, it dropped by a quarter. I think this is a very promising study. So how should we consume this 0.35 ounces of amani oil? It is recommended to drizzle it on salads. Why? Because this amani oil is said to be easily oxidized. Therefore, if you heat it, it will oxidize, and it is thought that the effective ingredients will decrease. So as a recommended way to eat, lightly sprinkle salad with olive oil and then drizzle amani oil on top and try eating it. Actually, you'll understand when you try eating this amani oil, it doesn't have a strong taste. Rather, it adds a bit of richness to the salad, making it easier to eat, so please give it a try. My personal recommendation is to sprinkle diced 6-piece cheese or block cheese on the salad, which adds even more richness and makes the salad even more delicious. How about that? I think it's easier to understand if you think about the data and why it decreases. And on YouTube, various medical professionals are disseminating information. There are many beneficial things, but some information may be incorrect. To avoid regrets, let's continue learning together. Following this eating method will likely decrease it. What medicine would be necessary? For questions, comment. Every Tuesday at 9 post-meridian. If you have any questions, please leave a comment. I do a YouTube live every 9 o'clock, so I will answer there, so please wait if you like. And to not miss new videos, please subscribe to the channel. Soybeans, the fourth of 7 ways to lower cholesterol, is a lesser known method. Many people may not have heard about soybeans' cholesterol lowering properties, as it's not frequently mentioned in other YouTube videos. This information really motivates me to learn more. It is noted that something called isoflavones contained in soybeans may lower total cholesterol or bad cholesterol in the human body. It is noted that it may lower total cholesterol or bad cholesterol. When I introduce a certain study, the subjects eat beef, but on the other hand, they include soybean oil derived from plants. They ate beef, and on the other hand, they ate regular beef. The result was surprising. The soybean oil changed. Those who ate the beef had, compared to those who ate regular beef, bad cholesterol decreased by 9.3%, and total cholesterol decreased by 14.9%. It's said that eating meat raises cholesterol, but just adding soy-derived fat to that meat lowered cholesterol. This suggests that soybeans themselves may have a cholesterol-lowering effect. However, it's not often possible to add soy fat to the meat we usually eat. I can't do that either. So as a simple and inexpensive way to consume soybeans, there are natto and tofu. Let's switch to a conscious Japanese diet. Especially recommended is to add tofu or natto to one of your dinner dishes. Just by doing that, you can increase your intake of soybeans, so please give it a try. Soybeans themselves are rich in protein, which is a very important nutrient for making our bodies, so I recommend taking in soybeans for that reason as well, as a personal recommendation, and then carve into natto. Sprinkle chopped green onions on it, and then it's really delicious to eat it with egg yolk on rice. The fifth of the 7 ways to lower cholesterol is here. It's about fish. Everyone, haven't you had the experience of being told by your parents to eat blue fish because it's good for your brain? It is known that the oil that makes up the brain, docosahexaenoic acid and icosapentaenoic acid, are abundant. Therefore, when you eat fish that contains a lot of docosahexaenoic acid and icosapentaenoic acid, whether you believe that your brain will improve or not is up to you, but lowering cholesterol and reducing the risk of diseases that clog your blood vessels is. More and more data is being collected. In a meta-analysis that summarizes 11 studies, a highly credible study says that consuming fish 4 or more times a week can reduce the risk of myocardial infarction by 21%. It's not just about lowering cholesterol, it's about what's waiting for you beyond that. There is data that says we can reduce the risk of myocardial infarction. And the interesting thing is, the more fish intake increases, the lower the risk becomes. Studies show that for every 3.5 ounces of weekly fish consumption, the risk of myocardial infarction decreases by 5%. Thus, those who consume 7 ounces have a 10% reduced risk. This trend is believed to continue, but the text is incomplete. There are points to be careful about. Just because fish contain a lot of docosahexaenoic acid and icosapentaenoic acid, if you consume a large amount of fish, there is also a risk of mercury poisoning. It is known that fish contain trace amounts of mercury, and by eating a large amount of this mercury, the risk of mercury poisoning increases. If you get mercury poisoning, you may start vomiting, have stomach pain, diarrhea, dizziness, difficulty seeing, and suddenly your kidney function may deteriorate. Such serious symptoms can occur. In fact, it contains a lot of mercury. Fish known to contain high levels of mercury are swordfish, shark, king mackerel, tilefish, and tuna. These types of fish contain relatively high amounts of mercury, so it's recommended to limit your intake to 2.82 ounces per week. On the other hand, they also contain a lot of docosahexaenoic acid, which reduces the amount of mercury in the body. As for what kind of fish, it could be something like sardines. Another example is mackerel that has been raised in the Atlantic. And then there are shellfish, squid, seaweed, and so on. These types of fish also contain a lot of docosahexaenoic acid, and conversely, the amount of mercury is considered to be low, so please consider this. Personally, my recommended way to eat it, which I also practice, is canned mackerel. No matter how you look at it, canned mackerel is convenient. The flavor is already there, so as soon as you open it, you can eat it. During busy work hours, I can control my cholesterol by eating canned mackerel for lunch. It's a good idea to get your protein from fish and turn it into energy, so please try incorporating things like mackerel and sardines into your life. The 6th way to lower cholesterol is nuts. The data on nuts is as impressive as that on mackerel, so nuts are a good choice, especially when it comes to walnuts. As I mentioned earlier, walnuts contain omega-3 fatty acids, which are famous for lowering cholesterol. Other nuts also contain a lot of unsaturated fatty acids, which are said to lower cholesterol. Therefore, the data on nuts is as impressive as that on mackerel, and it is almost certain that they lower cholesterol and prevent blood vessels from hardening. It is said that the risk of death decreases. I will introduce a large-scale study. In that study, when comparing people who do not eat nuts and people who eat nuts more than 5 times a week, it was found that people who eat nuts more than 5 times a week had a 14% lower risk of heart attack and stroke. Not only that, but the nuts included in this study were peanuts and walnuts. This is a study involving over 5 million people, so it is considered quite reliable. Personally, I recommend eating nuts in small bags. I suggest eating nuts in small bags as a substitute for snacks. My workplace is full of these small bagged nuts. The good thing about these small bagged nuts is that they are handy, you can eat them to a certain extent, and you feel like you've eaten something. They are cleaner than eating snack sweets, so you can eat them while working when you're a little hungry. And the reason why I recommend them as snacks is because they are generally high in calories. So by replacing them with nuts, you can reduce your total calories, which can ultimately lower your cholesterol and reduce the risk of heart attack and stroke. So please try to find nuts in small bags on Amazon or something. Personally, I highly recommend it. I would like to recommend walnuts, which contain omega-3 fatty acids. Did you know that? The 7th and final dietary method to lower cholesterol is the Mediterranean diet. As we have emphasized many times in the past on YouTube Medical University, this Mediterranean diet not only lowers total cholesterol, but also lowers neutral fats in people with diabetes, and more. Above all, it lowers the risk of arteriosclerosis, heart attack, and stroke. But that's not all. It also reduces the risk of cognitive disorders and certain cancers. It's a superfood. The Mediterranean diet is a diet from the Mediterranean coast of Europe, which is rich in seafood with fish at the center. Vegetables, fruits, and dairy products are also central to it. It's an eating style that uses red meat and salad oil sparingly. Fish and olive oil are central. The dietary habit of consuming fish and soybeans is very familiar to the Japanese. The natto and tofu introduced earlier, as well as sardines, are included in the Mediterranean diet, each of which can lower cholesterol. That's the kind of expectation we have. In fact, we have compiled 6 experiments. In a highly credible test called a meta-analysis, we gathered 2,650 people who were overweight and had them eat a Mediterranean diet and a low-fat diet. As a result, the group that ate the Mediterranean diet had an average total cholesterol level 7.4 points lower. It's understandable that cholesterol would drop compared to those who don't eat anything, but it's surprising that cholesterol dropped even compared to the low-fat diet. Thank you for watching this video until the end. I would like to introduce you to a specific Mediterranean diet menu. There is an official line in the summary section. From there, please register as a friend and just type in Mediterranean diet. Then, you will automatically be presented with a free chart summarizing the recommended Mediterranean diet and the amount you should eat. It's completely free, so please take it if you like. Now let's review the second limit. In the 7 dietary methods to lower cholesterol, we introduced phytosterol-rich oils, fruits and grains first. Sesame oil may be difficult to try. Second is water-soluble dietary fiber, which can lower cholesterol when consumed more. Consciously eat foods like soybeans, young leaves and sticky foods. Third is almond oil, which contains We explained that alpha-linolenic acid contained in almond oil may lower low-density lipoprotein cholesterol. We recommend eating it without heating it, such as in salad dressings or as a final touch in cooking. The fourth one is soybeans. We introduced a paper that just by adding soybeans to minced meat, the value of cholesterol is lowered. By being aware of Japanese food and just adding one dish of soybeans or tofu, cholesterol may decrease. The fifth one is fish. We introduced that if you consume fish 4 times a week, the risk of myocardial infarction decreases, and for every 3.5 ounces consumed per week, the risk decreases by 5, and so on. You need to be careful about mercury, so we recommend consuming fish that are low in mercury, and as a recommended way to eat, we introduced that mackerel and sardines are the easiest. The sixth one is nuts. By eating nuts more than 5 times a week, the risk of myocardial infarction and cerebral infarction decreases. And as a recommended way to eat, it's nuts in small bags. We recommended replacing it from your usual snacks. Among nuts, we especially introduced walnuts, which are rich in omega-3 fatty acids. And the seventh one is not just Mediterranean diet cholesterol, but the risk of blood vessels hardening. The Mediterranean diet, which is said to reduce the risk of neutral fats, cognitive disorders, cancer, etc. Please try to incorporate it into your life. Eating is a matter of frequency. I think there are times when you want to eat fatty or sweet things occasionally. However, even if you reduce that frequency a little and increase the kind of food introduced today, I think that cholesterol will gradually decrease. How about that? This video covers signs of neck blood vessel strain, including glaucoma and difficulty seeing. It also discusses symptoms of transient ischemic attacks before a stroke, such as speech difficulties and weakness. The video then focuses on lowering cholesterol through diet and lifestyle changes to prevent hardening of the neck arteries. YouTube Medical University provides this information. We will continue to broadcast videos that can become healthy from tomorrow, responsibly based on data from the doctor's perspective. If you want to support us, it would be encouraging if you could register for the channel. Also, then, it's okay with this video good button or bad button, so if you could evaluate it, it will lead to improvements in the next video. And then, if you have any symptoms you have experienced in the past, what the doctor told you, and the eating habits you are actually doing in the comment section, please let us know in the comment section. It should be a reference for those around you who are watching. And then, join us for our weekly YouTube Live every Tuesday at 9 post Meridian from YouTube Medical University. We answer viewer questions and discuss health together. See you next time. Our Amazon bestseller, which I learned from general medical patients, teaches how to live without aging from your 70s onward. In the course of working as a doctor, I compiled into one book the important ways of life and health methods that I learned from patients. I also want to live healthily in this way. It has become a book that makes me think so. It's selling well, so please check it out. Thank you for watching.